We all know how important mental health is. But what about dogs? Do they also suffer from mental illnesses? Let's find out. Your dog's body language can tell you a lot about how they're feeling. A study conducted by Emory University scientists in 2013 showed that dogs' brains are strikingly similar to the human brain, especially when it comes to emotions. Like humans, dogs who suffer from conditions like anxiety or depression can self-harm and severely damage their overall health by not eating or exercising. Any dog can suffer from mental health issues, but it is a common and heartbreaking problem for dogs who have been neglected, mistreated, or abused. More significant events that can affect our dog's mental health include an addition to the household, such as a new baby, adopted child, spouse, roommate, or pet. Someone leaving the home, for instance, a child going away to college, a spouse moving out after a divorce, or the death of a family member or pet, moving to a different home or apartment, shifts in routine due to children going back to school, or a job change. In addition, dogs may show signs of mental health issues after something traumatic happens, like getting hit by a car or experiencing a disaster, like a hurricane or house fire. Abnormal nervous system activity. There are a number of mental health conditions dogs can experience, but these are some of the most common disorders found in canines: separation anxiety, social anxiety, noise anxiety, obsessive compulsive disorder, depression, attention deficit hyperactivity disorder ADHD, canine cognitive dysfunction syndrome, post-traumatic stress disorder PTSD. Let's talk about separation anxiety. Many dogs enjoy spending time with their owners, but separation anxiety is more pronounced than moping when you go away. Excessive barking, urinating and defecating inside the home, and chewing furniture are all common behaviors in dogs who fear being left home alone. Social anxiety. Dogs often develop social anxiety when they've previously experienced neglect. For instance, dogs who have been rescued from puppy mills, were strays, or saved from situations of abuse or neglect. This social condition can cause dogs to experience crippling anxiety when being around other dogs or humans, and can even lead to aggression. Noise anxiety. This fear-related anxiety is triggered by loud sounds like thunder or fireworks. A car backfiring or loud knocking can also cause noise anxiety. Dogs with noise anxiety can bark, shake, tremble, whine, cling, cry, and hide. Post-traumatic stress disorder. While this is more often observed among working dogs in the military and the police, regular dogs can suffer from PTSD too. PTSD is a severe anxiety disorder that is caused by traumatic events like a car accident, a fight, or an injury. A traumatized nervous system can result in behaviors like panic attacks, heavy and fast breathing, anxiety, being excessively cautious and clingy to their owners, aggressive behaviors from usually non-aggressive dogs, depression, and hyper-awareness. Obsessive compulsive disorder. Dogs aren't diagnosed with obsessive compulsive disorder like humans. We don't know if they have obsessive thoughts, which is a hallmark of this illness for humans. However, anxiety, fear, boredom, frustration, and other negative emotions can lead to compulsive behaviors. These behaviors are exaggerations of normal dog activities, which are done for longer periods of time and repeated in situations where they wouldn't be expected. Behaviors that can become compulsive include barking, chewing, excessive licking, pacing. Enjoying the video so far? Don't forget to like and subscribe. Depression in dogs. Can dogs get depressed? That's a good question that doesn't have a simple answer. We can't really know what goes on in their minds to equate it with human depression. However, We do know they can experience deep sadness and show signs of depression similar to people, such as appetite loss, lethargy, inability to sleep or sleeping more than usual, withdrawal from social interaction. Depression in dogs is usually temporary and often comes in response to a major life change, such as moving to a new home. It will often resolve itself as the dog acclimates to their situation. ADHD. Dogs who spent more time alone and who participated in fewer activities, and fearful dogs, who are often not as well socialized, are more likely to be hyperactive and/or impulsive. Symptoms include high energy, being distractible, lots of fidgeting and movement, not being able to pay attention, impulsiveness. Canine cognitive dysfunction syndrome. This is the canine version of Alzheimer's or dementia, and as such generally doesn't occur until your dog's quite advanced in age. Dogs with CCD show behavioral alterations such as disorientation, altered interactions with owners, other pets, and the environment, sleep-wake cycle disturbance, house soiling, and changes in activity. Now the most important question: when to visit the veterinarian? If you're concerned about your dog's mental health, you should reach out to your veterinarian to help address your dog's suffering sooner than later. Issues like compulsive behavior can also be easier to treat when they're addressed before the behavior becomes too ingrained. Early treatment can also prevent injuries and avoid disruption to your household, which can be stressful for everyone in the home. Treatment. Treatment will depend on the nature and severity of the problem. It can include lifestyle adjustments, desensitization, behavior modification, and medication.